In Kenya, many cancer cases are identified in their advanced stages when treatment options are limited and the cost of treatment is too high for many families. Health professionals say this is largely due to the fear of stigma by patients that holds them back from seeking care sooner. CGTN's Anastasia Waweru reports.
In Kenya, the health sector is struggling to deal with late cancer diagnosis, often caused by denial among patients and the fear of stigma. This remains alarming, considering data from the nation's health ministry indicating that there had been a 30% rise in cases between 2012 and 2018.
For the female patients, the most common cancer that we handle is breast cancer. Coming in a close second is cancer of the cervix, and then there is cancer of the colon. Then for the male category, there is prostate cancer, followed by a very close second of colon cancer. Sadly put, number one, there is a lot of stigma associated with cancer of the cervix. We have to factor in a lot of our cultural background finds any topics to do with sex, the female reproductive system, a bit taboo.
I was in denial. I didn't tell anybody. I just kept quiet. That was in 2018. I did it in September. I got the results in October. But I didn't tell anyone. I was in self-denial.
But that's not the only reason holding back patients from seeking treatment. The financial burden of the disease locks out many Kenyans from accessing much-needed consultations and medication.
Outpatient, 70,000. Within, you see, like if I go for one chemo, I pay like 35,000. You meet, you don't know, within how much you will take your only 2 months. Then you are left in borrowing out money from people. And still, you need special diet where you didn't get the money from. You go to people, sometimes even you call people, they don't even pick your course. But anyway, there are those who have been there for me, and then just thank them.
I got my cancer diagnosis in 2016, and it was literally my world just got flipped around, and I was on the receiving end of the same healthcare system that I was working in. And the funny thing is, I went in thinking I know everything and realized I don't know anything about what patient journeys look like.
According to a World Bank report, less than 20% of Kenya's 53 million people are covered by the National Health Insurance Scheme. This has further compounded the crippling burden of handling cancer cases. Experts say health costs are pushing more than 1 million Kenyans into poverty annually. Anastasia Waweru for CGTN.